Good day. Dr. Linskyi here. I'm glad to welcome you to our channel. In today's video, we'll talk about the coronavirus. A lot of users have electropulse therapy devices, such as the ENART 911 and the ENART 907 models. This is what they look like. I show you those devices which I personally work with. These people are asking, what can be done for the prevention and treatment of viral diseases like coronavirus? Can perhaps electropulse therapy help in this matter? So therefore, I decided to share my practical experience. I've been working with ENART devices for a very long time, more than 10 years. I've been dealing with electropulse therapy since 2002, and I have been working with the ENART devices, if my memory serves me, since 2009. During this time, a lot of patients have passed through my practice, and in addition, I actually use these devices for self-medication, and therefore I think my experience will be useful for you. So let's begin. First of all, let's analyze how the virus works from the information that is already known. The lung tissue is primarily affected. The virus enters the interstitial tissue. There in the capillaries, the small vessels, microthrombi appear, and the alveoli lose their ability to conduct gas exchange. The lungs breathe with tension or stop breathing at all. Pneumonia develops somewhere in the second day. On the 10th to 11th day, it is already in full swing. And if at the beginning of the disease, microthrombi appear in the capillaries, they degenerate into a connective tissue, which is fibrosis. This is very dangerous because fibrosis tissue is a connective tissue and is very poorly supplied with blood vessels, and practically it does not go away with time. Therefore, a person very often dies precisely from interstitial pneumonia. The next tissue that is affected by the virus is a myocardium. Myocarditis occurs and the heart carries a huge load, as in this case. There is intoxication. Why it occurs, we will address a little farther on. Intoxication occurs, and the body then requires a huge amount of energy, and the heart, respectively, also experiences stress. And if a person has some kind of concomitant pathology, then it is in the direction that complications will arise. The next organ that affects the virus is the liver. The liver, as I think most of you know, is a detoxification organ, a filter of our body. And if this filter does not work, especially in extremely stressful conditions for the body, then a person can also die. And if in the case of the cardiovascular system, you have problems with biliary excretion, there are problems with the liver. And then the chances of serious complications naturally increase. Now, there are three main body systems that we will act on. Naturally, there are many more factors influencing the development of this disease. The urinary system, the state of the intestine play a role because toxins are excreted through these systems, in addition to the liver. So, why does intoxication increase in the case of coronavirus disease? Besides the fact that it is a reaction to the virus itself, to its waste products, the virus itself suppresses the enzymatic system in the protoplasmic epithelium, where he also loves to live. In the normal state of the body, it is here that the P450 enzymes act, which are involved in the oxidation of toxins. In particular, in the first phase, there is the oxidation and further elimination of oxidation products. Therefore, when this enzymatic system is suppressed, toxins cease to be processed, and accordingly, they cease to be excreted. And this further exacerbates the overall picture of intoxication. So, these will be the main organs and systems we will now influence using the means we have at hand, namely the ENART 911 or the ENART 907 devices. It is not important what version you have or how advanced this device is. Whatever level it is, any ENART 900 series device can carry out the necessary treatment. And in my opinion, using these devices, it is possible to resist the medical problem much more effectively. This will be a significant help to the body. Now, why am I saying that? Because I have repeatedly used these devices for various diseases of the respiratory tract, including with pneumonia, with flu, with complications, and these devices showed themselves very well. Therefore, I will now demonstrate what we can do for self-medication and disease prevention, such as a small master class. So let us begin. I had to take off my medical gown because most of the treatment areas are on the body. I think you will not mind if I show it on myself. The fact is, in this case, it is important to show the process of self-medication, how a person can conduct the treatment himself, because there may not always be someone nearby who can treat the zones on your body with the help of the device. Another person may not have the necessary skill, or simply may not be anywhere nearby. Therefore, the task is to show you how a person can help himself. So we start with the pulmonary system, an important point. And as I have known about this for a long time, this has been confirmed by the cases of my patients. Also, in the literature, there are many studies. There are many results that electropulse therapy devices, in particular ENART 907 and ENART 911 models, work very well with a structural pathology, that is, with a fibrosis. So, when edema occurs, then fibrosis occurs. Connective tissue is the same as with interstitial pneumonia, and then sclerosis. We are now specifically interested in this particular fibrosis, and as it turns out, these devices cope well with this problem. There are even cases where the newly formed connective tissue was completely absorbed, and I think that with this method will be applicable to pneumonia, which is caused by the coronavirus. In addition, the lung tissue is very rigid. That is, given a very small inflammation, it immediately becomes scarred, and this same fibrosis problem arises. As practice shows, if we carry out treatment with the ENART device during the height of pneumonia, then as a rule, there are no complications, recovery is many times faster, and sometimes even without antibiotics. Sometimes there are cases where the antibiotics do not work and the people turn to us, calling help. When we begin the ENART therapy, the problem is usually solved. So if we work with the device at the time when the person is in the midst of pneumonia, then as a practice it has been shown the results are very encouraging. In particular, fibrous tissue does not form, or it is formed many times less. Therefore, I believe that this property of these devices acting on connective tissue, on fibrosis, is very important. And this treatment method can also be used to treat the effects of a coronavirus infection. So let's begin with lung tissue. Primarily, we treat the neck. And why the neck? Because many nerves come through here, including those connected to the lungs. In particular, the phrenic nerve is associated with the diaphragm, and this also affects the lungs. And also, the vagus nerve passes through here. Those who watch my videos know that ENART innervates all the internal organs. So we treat the neck. It can be treated in two ways. You can treat by points or by moving the device evenly and slowly. I'll show you both ways. Immediately, we produce an effect on the vagus nerve. We set the device to diagnosed 1 mode, or it can be set to EN mode, as it is stimulating. We increase the power and apply the electrodes approximately in the projection where the vagus nerve passes. Oh, we hear 3 short tones. There are 3 short tones here. And here we just hold steady. I'll reduce the energy a little. You can hold it to 0, that is, up to 2 lengthy trilling tones, or you can stop at 2 long tones. This is the minimally effective dose. If the device shows several points, it will produce 3 short tones. This indicates that they are the highest priority for treatment, and you can treat them all. Or you can choose only one of them. If you're constrained by time and you need to treat quickly, then you can just use one point, the most effective point, which the device will show you. That is, it will have the highest, fastest response. It will be prioritized in comparison to all the other points that you could check. And the device will always signal with 3 short tones at this exact location. My device doesn't want to quickly finish the exposure. I guess it believes that the point needs additional treatment, but to save time, I will move it a little. Here, 2 long tones. That's the minimum effective dose. In the same way, I will conduct symmetric treatment on the other side of the neck. Then I will switch to constant 1 mode. In the ENART 907, we'll set the desired frequency here, and I prefer to use a frequency of 60 Hz. In tens, it equals 3. Energy, set it as you feel comfortable. As we begin with a smooth movement from top to bottom. Here, from the mastoid process, also there's an owl-shaped process inside. There, the vagus nerve exits through the jugular opening. Likewise, I symmetrically treat the other side of the neck. Now, I'm working quickly just to demonstrate the method, but you probably will spend 5 minutes on it. Also, you can treat the cervical spine. So we go into the SM mode. It is used for muscular skeletal system and is quite effective here. This mode also has a diagnostic function. So I begin to explore the neck in search of points that are of high priority to treat. A short tone is heard. 3 short tones. Oh, another priority point. Even more priority. A short tone. Oh, going back. Okay, the 3 short tones. And here I can hold it until the device reaches 0, the maximum dose. You see, it is very convenient for the device being equipped with an audio indicator. That is, diagnostics can be performed without looking at the monitor. Very convenient for self-treatment. Well, here is minimal effective dose. And so I can go forward through a few points on the neck. Now the device reports the value of the final reaction. In the future, I can set to constant 1 mode in the ENART 907 and process this zone from top to bottom in a smooth movement, just as I treated the vagus nerve. Further, you can also treat the neck as follows. We set the constant 1 mode in the 907, const in the ENART 911, with the same parameters I talked about before. The frequency is 60 Hz. In tens, the number of peaks in the pulse waveform is 3, and I begin slowly to work on the neck area in a circular pattern. So, move very slowly around the neck. Front, and then go to the back surface. I demonstrate here a little accelerated speed. In a real session, this should be done about 2 times slower. This way. And after that, you treat the whole neck, as I showed earlier. And next, we work on the lungs. Initially, I would advise finding areas that are high priority for treatment on the sternum. we set the appropriate mode, and I prefer to use the SC mode in this case. Here it is, the second, the SC mode. It is primarily for treatment of internal organs and is also equipped with a diagnostic function. Now we find the highest priority points. Here there are 3 short tones. And back. This is the highest priority point for processing. The device emits 3 short tones. You see, I have a rather thick hairline on my chest, but nevertheless, the device works correctly. Here a signal sounded after achieving the minimal effective dose, since I set the sensitivity a little higher. In the ENART 900 series devices, the sensitivity is adjustable. You can reduce it if a person has wet skin. Here, a signal sounds to report that it has reached 0. I set the sensitivity of the device higher and I work on the hairline. And further, I can go through the entire sternum, in the center, on the sides, and find the points that are of high priority for treatment, and treat them. Next, I set the constant 1 mode for the ENART 907, constant for the ENART 911, and I can process the entire section from top to bottom in smooth movements. The device works correctly, although no hairline is present. And so we process it several times. Further, you can go through the entire sternum along diagonal lines, as we will treat both the lungs and bronchi in this way. Starting the outside and continue moving inward. This is how the lungs are treated. And from this side. Further, it is advisable to go through another area of the spine. I set the mode to SC. You can also set the mode to EN, as both are equipped with a diagnostic function. I set to the SC mode and start treating the spinous processes. These are the central protrusions on the spine. I am starting to find priority points in this zone. See, I cannot look at the device screen, but focus only on the sound alarm. Here there are 3 short tones. And I have found a point and am treating it to the minimally effective dose, or also to the 0. And I can additionally treat other points. See, I go lower, and then I get it from the other side. If you can't reach these places, then of course it's better to ask someone for help. And so we will treat this zone. The next movement is by the heart. We've already treated the neck, and this will also affect the heart, because here 3 nerves pass, the upper, middle, and lower, and thus the vagus nerve also passes here. They just innervate the heart. That is, it'll have an effect on the heart too. Also, we process the spine. This will also help the heart to cope with the problems that occurs when the virus attacks us. And the next zone is the liver. We set the SC mode. As I said, it is primarily for the treatment of internal organs. Here it is. I specifically do not give any complicated methods, so anyone with little preparation can help themselves in this situation. And in such situation, there is no time to understand the complex treatment methods thoroughly, and the devices you see facilitates our task, showing the points that are of high priority for treatment. We have a liver on the right side, as you see above here. You see, here comes the costal arch, and the liver, and a little higher and a little lower than this. It is the SC mode that we look for and find points for treatment. Here are 3 short tones. This point was found, for example, So we treated to 0. Next, we went below. Here they found priority point, and it was treated also. Then on the back, this will affect the kidneys. Oh, treated. Then we'll switch to constant 1 mode for the ENART 907, CONST in the ENART 911, frequency set to 60 Hz. And in this way, going from the outside to the inside, it is also much slower than I am showing you now. And we are treating the liver. For those with the ENART 911 version L2, you can activate constant 2 mode in the ENART 907 or the delta const mode in the ENART 911. It shows the zones while the unit is in motion. So I set it, held it a little bit, and started to move slowly. You see, here's the point that I found in the SC mode. And at the same place, the device gives a signal in the constant 2 mode in the 907 or delta const mode in the ENART 911. And I can just hold it at this point until it is fully treated and the device gives the signal. Here is the liver treatment. And now we'll show you the reflexogenic zones that enhance immunity. We call them the general purpose active zones. That is, they affect the whole organism, and such a zone as a rule we treat once during a session. It enhances the overall effect, and thus immunity. We will use these areas for both prevention and treatment. So, first of all, this is the 6-point zone, or the trigeminal nerve exits. Here are the corners of the mouth, and a little lower of the nose, and somewhere in the center where the eyebrows begin, a little higher, we have the device that will definitely show specific points for treatments, since it is able to take information, point parameters, and show you exactly where to treat. I prefer to treat this zone with diagnostic 2 mode in the ENART 907 with a frequency of 100 Hz. Those with the ENART 911 can set the desired frequency in the Diag 1 mode. In the ENART 907, there are several modes to select various frequency parameters. In our case, this is enough. So here we go. See, I start with one of these points below. 1 short tone, 3 short tones. Here is the point. We treat to the least or minimally effective dose. Then we find a symmetrical point on the other side and treat it. Next, we find and treat the point near the nose. Similarly here on the other side. And then we find and treat points above the eyebrows. Here, and here. Treat it. Another powerful reflexogenic zone is the suprasternal notch. It can also be treated with a diagnostic 2 mode in the ENART 907 or Diag 1 in the ENART 911 with a frequency set to 100 Hz. I can arrange the electrodes in this way. I can do it in this way, whichever is convenient. So I treat to 0, that is to 2 tones. Then I switch to the constant 1 mode in the ENART 907 or const in the ENART 911. And you see, it is very convenient. I just know where the modes are, and I can switch the buttons without even looking. 2 long tones. Oh, this sounded a signal having achieved the minimally effective dose. So after processing to 0, the maximally effective dose, I switch to the constant 1 mode in the 907, and there I can set the processing time, say at a frequency of 15 Hz, with a range in this device. I can hold the electrodes of the device at this point for about 5 minutes to stimulate this zone as well. And another active zone is the seventh cervical vertebra. I will set this mode to EN. See, here is the top one. And the seventh cervical vertebra is the most prominent vertebra on the base of the neck. If you lower your head, put your hand on your neck, here is the most incoming tubercle. The most prominent vertebra will be the seventh cervical. I'll show you. In this zone, we find a point for treatment. Here. I can treat in the EN mode to 0. Then, if necessary, I can switch to some more powerful mode, especially if inflammation is present. You're already sick. And I can even switch to the FM VAR mode and hold it there for 4 minutes. I can do even more if necessary. Further, one of the powerful reflexogenic modes and the active zones is the liver zone. How to treat there I've already showed you earlier in this video. And the next zone is the interstitial zone. The interstitial zone, we have it around the navel, and we can treat it while in motion. We switch to the constant 1 mode in ENART 907 or const in the 911 and set the frequency to 60 Hz. And here we treat with circular movements. You see, with a setting on very high sensitivity, the device works correctly despite the hairline. We treat in a circular motion, clockwise, in an expanding spiral. As in other cases, this treatment should be carried out twice, moving as slowly as I am now showing you. I treat the whole intestine. Very well, by the way. This method helps with constipation. If diarrhea, then it is necessary to move oppositely in a tapering spiral and counterclockwise movement. From here, we gradually narrow down to the navel. I just show it for those who have this problem. Another reflexogenic zone is the Hegu point. Many of you know of it at the base between the thumb and the forefinger, somewhere around here. For the specific point to treat, the device will show you. I set any mode that has a diagnostic function. Well, let's say the same EN mode. See, I set the mode. And the device quickly found the right point. I will treat here, as before, to 0. Treatment can go very quickly, and the device itself will tell you when you need to finish the exposure. We will also find and treat the symmetric point on the opposite side. So I showed you several reflexogenic active zones to increase immunity. What I usually treat for daily prevention if there is a flu epidemic. I treat in the zone of 6 points, the suprasternal notch, and the zone of the second cervical vertebra. This is a very powerful impact, and often you will not even get sick. But if you're already sick, then it's necessary to carry out the full treatment of all those areas that I've showed you earlier in this video. At the peak of the disease, a session can be carried out several times a day, perhaps with a break of 3 hours. If you have a device, treat it several times a day. And if the lungs are affected, then you must treat the lung at each session, as I have shown, and besides that, at each session, treat other zones, one by one. For example, in the first session, you treated the lungs, treated the cervical region, and the active zones, the 6 point. In the next session, let's say you treated the lungs again, in the front, in the back, and treated the spine. Then you treated the intestinal zone. Since the intestine is connected with the cervical region, the interstitial zone was treated, and the next reflexogenic zone is the suprasternal notch zone. And in the next session, too, we treated the lungs, and for example, the zone of the liver, and the zone of the Hegu. Now, this is how sessions are roughly structured. I think this information will be useful to you. And if it is, put your thumbs up, subscribe to our channel, and repost this video. You can ask questions and comments. Wishing you the best of health.